More than 100 million Americans have a hard time going to sleep. Chad Justice, the sleep coordinator from Clinch Valley Medical Center, joining us this afternoon to talk about the problem that's kind of comes with the name of sleep apnea. You may have heard of that. And Chad, thanks for coming and talking with us. And
thank you, sir.
This is becoming really common. A lot of folks deal with this. What is it exactly that we're talking about?
Sleep studies and sleep apnea. Sleep study is a non-invasive test. It's performed overnight in a sleep lab. It's on an outpatient basis. You don't stay in the hospital, just it's an outpatient basis. Once that's done, we do that in the lab. And doctors need to monitor you while you sleep. There may be things happening in your body that may be related to sleep apnea. That's the purpose of that. We can monitor brain waves. We can monitor oxygen. We can monitor breathing, things like that while you're sleeping.
And that all plays a factor into the diagnosis of sleep apnea and how well a patient is sleeping at night.
It does, yes, sir.
Now, what goes into this sleep study? Folks may hear that and think, oh, I don't know about that. That sounds a little scary.
Right. It's nothing really to get upset or anxious about. These tests are performed in a quiet environment, in a private room. Most people do better than what they think they will. They're afraid they're not going to sleep for a certain amount of time. That's not necessarily true because we only have to monitor the test for a certain period of time.
Okay. So basically they're just coming in and going to sleep.
They are. We try to simulate the best possible night at home that we could. We try to maintain that environment as much as possible.
Now, what happens if someone has sleep apnea and they don't treat it? They just ignore all these symptoms?
If you're ignoring the symptoms of sleep apnea, it can be a problem. It can cause or lead to hypertension, diabetes, stroke. It can cause irregular heart rhythms or heart problems. The list is multiple, but that's just a few things that it could cause.
Now, for folks maybe that are having problems sleeping and think that maybe this is me that he's talking about right now, how do you make an appointment for that, or do you have any procedures before you can go for a sleep study?
Okay. Well, first of all, any doctor or nurse practitioner can order this test. Okay. This test can be ordered at Clinch Valley Medical Center and be performed overnight, like we talked about. It can be ordered by any doctor or nurse practitioner, and when that's done, we'll receive the order. We can schedule that test. That test can be scheduled Monday through Friday, and we also do weekends to try to accommodate schedules. So once that's done, then we can actually bring you in and do an actual sleep study.
So you kind of got to get that referral first. So go see the doctor or the nurse practitioner or provider, tell them what's going on, and then maybe they can refer you over to you guys.
Yes, that's exactly right. We need that order from them first, and then once we receive it, then we can proceed to go on and go through the procedure process.
Chad, thank you so much for coming in. And if you guys would like to find out some more information about a sleep study or Clinch Valley Medical Center, you can do so on our website at WCYB.com. In the Noon Show section, we have a link for you there. And it's great outside today weather-wise. If you've stepped out, you'll enjoy the temperatures. How long will it last? David lets us know when we get back from the other side of the break.